Hello, this is Dr. Judy Hutch with Oro Valley Audiology. Back to talk to you about tinnitus. Some people pronounce it tinnitus. It's like a tomato. I'll probably say that every time. Um, but what do we do when you come to us and say that you have ringing or buzzing in your ears? We have, of course, put you through a case history, and there are specific questions that we need to go over, and most importantly, what health conditions you have, like if you are diabetic, if you have kidney issues, if you've had chemo or radiation in the past, and over the counter medications are extremely important as well. Uh, this we know that there are some things that have an accumulative effect, meaning they're going to build on top of each other, or there's some that are kind of like a one-off. Aspirin, if you just happen to take a lot of aspirin, and we know that's temporary. So those are the questions that we'll go over with you. A lot of times that tinnitus is annoying, but it's not a health-threatening condition. But every once in a while, there are times that tinnitus can be contributed to different types of tumors and blood vessel issues. Again, it's very rare, but that's why we have you describe your tinnitus in as much detail as possible. So if something changes dramatically, or if it's a whooshing, like you hear your blood going through your blood vessels, that would really gross my son out. But those are things that we would want to know right away. Uh, I'll list some common causes, and number one is going to be noise exposure and medication. Dehydration. So here in Arizona, many of us walk around dehydrated. Now my mouth feels very dry. Um, Diabetes, kidney disease, thyroid disease, Meniere's, which I'm writing up conditions and what Meniere's is, but it's an inner ear disease, and so we'll be getting more content on our website on that soon. Pain relievers are huge under the medication. Um, and if you take medication for arthritis, there's some rheumatoid arthritis medications that might put you more at high risk, not only for tinnitus, but also for just hearing loss as well. So we want to look at that. Cardiovascular disease and your alcohol use. Some other things that are a little bit more rare are head trauma, middle ear diseases, and we look for different things like otosclerosis, which is hardening of the bones in the middle ear. Sometimes just having an ear infection will do it, but we can help the physician, the ENT, determine if those things are going on. An acoustic tumor, and these are very rare. In my close to 30 years, I've only found two, and I have been in contact with people who have been diagnosed before, but I personally have diagnosed a couple. Well, I gave the information to the physician, the ENT, and they made the final diagnosis. Eustachian tube disorders. So your eustachian tube is what connects your throat to your middle ear. So when your ears pop, you're popping air through your eustachian tube. And as we go through life, the eustachian tube doesn't work quite as well as when we were like 15. But also some muscle spasms in the middle or inner ear, and this can be a side effect of multiple sclerosis, MS. So these are just a little bit of a tidbit for tinnitus today, and I will talk more in depth on our next video. But anyway, I hope all are taking care, and just drop us an email at aurovalley@hereintucson.com, and that is going to be on our thumbnail because the closed captioning, I'm sure, will mess that up, as I say every time. Please take care.